today we're talking to somebody from Hawaii. Dr. Laurie Steelsmith is going to be back with me. And she, as we were talking, I was just getting ready to go, and her power went out. So we had a few minutes of flurry. So hopefully she'll hang with us. I apologize in advance if I lose her briefly, but we have a backup plan for her to dial back in. Anyway, so welcome to, it's a lunch and learn today. We shifted time so that we could get onto Laurie's very busy schedule. And I'm Sarah Heiner. And let me give you my usual reminders of everything, that we've got a growing library of these videos. They're in Facebook, but come to our YouTube page. It's a little bit easier. Actually, we have hundreds and hundreds of videos in there that we've been producing over the years, and great source of information on all sorts of topics in your life. And we take these videos, we put them in there, so it's easy to find, and come on back, tell your friends about it. If you want to share these videos, please share, talk about coming live, let people know you can come live with me, but also let them know that, you know, if you heard a great conversation, if you want to tell people tomorrow or later on that you just found out why your body is so achy, and you want them to see it, we're going to have it. We'll have it in YouTube probably in a few more days. It'll be on Facebook, but we'll have it in YouTube in a few days. But there's a growing library, so come there, subscribe, tell your friends. What else do I have to tell you about? Two other things. We've got these great downloads that we're doing. One that involves pain, about pain, all sorts of pain in our body. We all seem to be just painful, in pain. So Bottom Lines editors put together a free download book about some of our greatest information about pain. There's a link in the chat on Facebook there for you to download that. It's free. You can do it. Share the link with your friends. We just want people feeling good. And the other link that's in there to download is about immunity. The least likely for you to get sick is the stronger your immune system is. The more we can do to strengthen your immune system, then the least chances you have of getting all sorts of sicknesses, COVID, the flu, you name it, the chances go down. So download that also, a free download. And again, share it with your friends. The doctors aren't talking about it. Now they're talking about double, triple, fourfold masks. Put your mask on, social distance, wash your hands, and strengthen your immune system, please. Speaking about that, if anybody that really loves seeing me on Thursdays at 4 o'clock, tomorrow we're going to post, kind of rebroadcast, repremiere the interview I did a few weeks ago. Super important, vitamin D, with Dr. Michael Hollick. He's the top expert in vitamin D. And if you haven't heard the headlines, because they're really not out there, and if your doctor hasn't said it to you, because most of them aren't saying it, vitamin D deficiency, a very large correlation between that and the risk of getting COVID and the risk of dying from COVID. I mean, significant, huge. So watch that on Thursday, 4 o'clock. We're going to be rebroadcasting that. And on the Bottom Line site, we have information about vitamin D and the importance of taking it. Everybody should be taking it to be able to be certain to increase your defenses against COVID. Okay, now one more thing to remind you of, if you have questions. So we're going to be talking about pain today, aches and pains. Why are you so achy? Why do we hurt? Why is there chronic pain? We're going to be talking with Laurie Steelsmith about that. And if you have questions, as always, put it on into the chat box and someone will pass that information along to me. And with that, let me bring on Dr. Laurie Steelsmith, who's a little fuzzy. Why are you looking a little fuzzy?
The storm.
But otherwise, it's going to be beautiful in Hawaii when the storm is gone.
Yeah.
No question about it. So welcome. Thanks for being back. Let me tell everybody how great you are, because I know how great you are, but I'm going to tell all of them how great you are.
Thank you.
Right. Dr. Laurie Steelsmith is the medical director of Steelsmith Natural Health Center in Honolulu. She's a naturopathic physician. She's an acupuncturist. She's the co-author of 3 books, including the best-selling Natural Choices for Women's Health, a fabulous book. Women, go out and get it. She's also the author of our very popular blog, Natural Health Secrets for Women. If you don't subscribe to it, go to our website, subscribe, because it's great information on so many topics regarding women's health. Germane to the conversation today is that Laurie has worked with many patients to help them go from rigidity to fluidity and to resolve their pain. She's, through her work as a licensed massage therapist, as an acupuncturist, as an Iyengar, I think I pronounced that properly, yoga instructor, and as a naturopath who does therapeutic injections. And you can learn all about Laurie at drsteelsmith.com. So hello officially. We're going to talk about something called fascia, which sounds like a fancy word, and people are going, what's that? But if anybody has ever eaten chicken or steak and seen that the fibrous stuff around it, you all know what fascia is, even though you don't see it. So Laurie, first off, we've known about fascia forever, like, since Da Vinci dissected people, they've known that fascia is there, except that in recent years, knowledge has changed about it, and the whole view of what fascia does and what it provides for our bodies has changed. So how, why, what?
Well, it's actually an emerging field, which is amazing that they're just now looking at this connective tissue that holds everything together. I mean, when I was in cadaver lab back in, I think I was in the 80s. That's right. I mean, we just threw that stuff away. We didn't even think about it. It was just, it's like you throw it away to get to everything else. And what they're finding is that this is an incredible rich network of cells and fibers. And it's the stuff that holds everything together. And it's the stuff that holds the nervous system, the blood vessels. It's a unique electrical system. And actually, they even think that's where the meridians are. The meridians are in the fascia.
For the ancient Chinese medicine.
The ancient Chinese medicine. So acupuncture is interacting with these meridians, these highways of energy through this electrical system that's in the fascia. So you have all these peripheral nerves in the fascia. You have a lot of cells in the fascia, and people who suffer from a lot of pain, they're finding that there's certain types of fascia that lend itself more towards pain, and certain types of fascia that lends itself to less pain.
So are there layers of this stuff? Again, my vision of fascia is I clean my chicken and I ask someone to, to clean up my Chateaubriand for New Year's Eve, right? So it's all that fiber stuff. But are there different? So I can picture it around my muscles, but it holds our musculoskeletal together as well. Like, are there different layers of it that are just throughout our body?
It's throughout your entire body. Every organ is encased in fascia. So hence we have these therapies that have been around for decades, myofascial release therapies, and even some upledger therapies that have to do with cranial sacral therapy, and even organ manipulation therapies. And I've always wondered, like, what are they doing with this organ manipulation? Like, what are they doing? It's called visceral manipulation. Like, what are they doing?
Rearranging my skin. Right.
Yeah, and it's very subtle work. It's not deep work. So I'm like, how are they manipulating the organ? And what they're doing is they're working with that fascial plane to just gently move organs out of a twisted state or an abnormal state. And when I think back to my anatomy lab where we were doing dissection, I mean, people's stomachs were in different places. We had 3 different cadavers we were working on. And, one person's stomach was your classic stomach anatomically. The other one had a stomach that came down like this. The other person had a stomach that was like this. So, you wonder, well, is that just genetics? Is it has to do with impacts they've had to their bodies? But clearly, every cell, and then every bundle of cells, and then every muscle, and then every organ is all encased in this fascia. So it's this incredible network throughout your body containing nerves and blood vessels. And then it carries hormones, and it carries nutrients to your tissues. And it's an important part of your immune system. So it's this incredible network that they're just now finding new cells for. I just learned about a cell recently called a fasciacyte. Like, this has just been discovered. So it's a whole new frontier, which is so neat.
What's fascinating to me? Like, we think about the big organs, the brain, the heart, the lungs, like, those are easy to see. But some of the most important things that our body does, it's like it's hidden. Right. So there's this hidden fascial layer that's really the hidden communication network. I don't want to talk about the gut, but like the microbiome, all that junk that's in our digestive tract that people think is just junk, that's our emotions and our immune system that's all hidden in the middle of that. It's like that they figured out to hide all this most critical stuff in
That's right.
plain sight.
That's right. And, the microbiome affects your fascia because of if you have a healthy microbiome, you're less inflamed. If you have an abnormal, less differentiated, if you don't have a robust biome, you have more inflammation. So, I mean, that's the other thing is how like even these interconnectedness
Right.
between something like your gut and then, you know, your fascia, you know,
Right.
who would have
Okay. And
thought?
then, so let's talk about what the impact of the fascia is. I mean, you talked about like it holds us together and it's pain and communication, but a couple things specifically. So with regard to pain, so whether it's inflamed or it's tight or whatever. So so fascia equals pain, how? Right. So, you know, the
Okay.
restriction or,
Well,
and I don't mean a biology lesson. I want people to understand like
yeah.
what they're feeling, maybe fascia doing this.
Okay, so first think of fascia as the thing that's holding your body together in terms of you've got bones and then you have this stuff on the outside. And there's this idea of tensegrity. There's tension and then there's integrity. And they created a new word called tensegrity, where you have fascia scaffolding. Fascia is holding the big structure together, and you need to have that be a certain amount of tension in order to have integrity in the whole body, right? And fascia is this basically kind of like saran wrap around your whole body. And if it's too tight, you can't breathe. If it's too tight, you can't move. And they say that a third of your biomechanics has to do with your fascia and the quality of your fascia.
I'm
So
surprised
if
it's
you,
just a third. I would think it would be like 90%, given
I
that it's
know, but this guy comes from a professor of New York School of Medicine, so I took it.
I
And I
believe
mean,
it. I'm just
I'll
surprised.
believe him.
Right.
But I actually think I agree with you because, you know, you can't just isolate one thing.
Right.
And, you know, the fascia quality is what enables you to have that freedom of movement. I mean, almost, you know, all body therapies and movement therapies, they're all about having freedom of movement, right? Effortless movement. And when people don't have that, we need to look at why. And the quality of your fascia, the quality of that connective tissue, on a cellular level is what's important in order to have that fluidity and flexibility, because fascia actually has a lot of water in it. It has a lot of slippery, gooey qualities to it. And it has a lot of qualities that allow it to stretch by splitting itself. There are some amazing films online people can go to see how when you stretch, you literally see the fascia start off as a bundle, and then it will literally stretch like this to separate, to accommodate that. And some people genetically have a better ability to do that. And those are your very flexible dancer types, right? Your people who gravitate towards yoga, or the temple dancer, right? They're very bendy. And then there's the Vikings, and this is all from Tom Meyer's work. He calls it the Vikings have very stiff fascia. So it's very hard for them to be bendy, very hard for that fascia to split. And, you know, but you can influence your fascia. I mean, this is maybe why we're doing this talk. Like, you can influence not just by the movements that you do and the body therapies you get, but through your diet, through supplementation, through having this healthy cellular matrix.
Yeah, we're going to talk about what do you do about it? Because I always end up with what do you do about it? I'd like everybody to know what can I do to help myself. So we're going to talk about the physical treatments that you can do, and then some of the food and diet and those kinds of things as well. You know what, though, again, this just strikes me so powerfully. And I've been talking about this a lot with regard to our bodies and our emotions and feeling good and happy and things like that. This is another example with naturopathic philosophy of the integration of our body, that it's not just body parts, but the fascia, right? But the fascia that connects all the different parts of the body and the organs and the musculature. And it's like not too tight, not too loose, like, but it's looking at it systemically and holistically, not just as your fascia is broken or your, you know, bicep is broken. And I just think that's such an important message for everybody to really absorb for their own health and wellness in general.
Yes, and discussing fascia is the perfect interconnected to all things. I mean, it's pretty amazing. Like, even as women's hormones change, the fascia changes. We know that even during the menstrual cycle, it changes. Like, there's all this new research. I think it's brand new research coming out on how estrogen influences different collagen fibers.
Wow.
And that when you hit menopause, you become stiffer because you end up with more of these collagen 1 fibers. Right? And so then your joints aren't as flexible. And we have to think of fascia and collagen as kind of together. Like, collagen, we all think about collagen, right? As we get older, we start to, you know, like, wait a minute, what's happening here?
Yeah,
me
I
just
see
pull
it
this up a
every
little
day
bit.
as I'm looking at myself on this screen. Thank you.
Right? You're beautiful. And it's just that estrogen impacts collagen, but it also is affecting you like inside your joints, inside your cruciate ligament, right in your knee. This is this big crossing ligament in the knee. So they're even doing research now to look at young soccer players, and why is it that young women who play soccer tend to have more of these cruciate ligament issues and tears? And it's because of their hormones.
Right.
It's because of their estrogen. It makes it looser so that their pelvis is more able to open, right, and deliver a baby, right? How is it that the cervix can go from this to 10 centimeters wide in order to deliver a baby? It's because there's all these hormonal changes that take place to allow for that connective tissue to shift.
Yeah. Well, and then there's another aspect, and then we're going to move to the what do I do about it? The lymphatic system as well, the immune
Yes.
system that also flows through the fascia and I guess tight dry fascia doesn't allow the release of toxins and waste products in the same way as well.
That's right, because your lymphatics don't have a big heart behind them to pump, right? Like our vascular system does. So your lymph system is only going to be able to take all the debris from your feet and bring it back up to the cisterna chyli up here in your chest to dump it into the subclavian vein in order for the liver to process it if you move. And if your fascia is stiff or you're not moving, you're not going to be able to get all that cellular debris, right? Every cell has garbage. Every cell releases that garbage and it moves into the extracellular space, the lymphatic system, and has to come back up and get processed. So, and people that, one way to support your fascia is through movement, exercise, any kind of movement. And then there's all kinds of other therapies, which we'll talk about, that can also help to support that lymphatic movement.
Right. But it's just, again, I probably get too geeky at all this sort of stuff, but it's important. I just think it's so important to understand the big perspective of this stuff. So we're talking about pain. This is pain, but again, it's your immune system, like to have your fascia in shape, to take care of ourselves, as we're going to talk about. So important for our overall health. Now let's talk for a second about injury, because fascia, so it's easy to say, okay, I'm tight in my body, but if you get an injury, one of the interesting things about fascia is that you might have a pain in your neck that really starts someplace else. And I saw an interesting picture, like if you pictured your body, picture like a spider web, and that if you touch it here, it goes out of shape there. So that when it's the pain, like this network that if you have an injury, it radiates. Like you could have a disparate, you could have a pain here, but an injury there. And that also might be connected to fascia.
And that's been known for decades. I mean, there is Dr. Travell's work on trigger point therapy and referred pain. I mean, that's been known for decades, but I don't think they've connected it to fascial patterns. And what Tom Myers, who's he was a Rolfer, and he's created a book called Anatomy Trains. What they talk about is the fascial lines, and there are these amazing fascial connections between the foot and the tongue. I mean, I'm not kidding, between, there's fascial lines that cross, there are fascial lines that cross the body. So for instance, I did have a problem here in my neck, but to fix it, they needed to treat me over here in my ribs. Like this was where the problem was. It wasn't necessarily my neck. And to get my head to be where it's supposed to be on my head, not forward, not back, not too much to the side, the whole left side needed to be treated. So it's, and the same thing happens like with knees. It's not always a knee problem. It's often something going on with the hip or the ankle, or even be related to another part of your body. So a really good body worker, or anybody who's doing structural type work with you, you need to see someone who can see those associations, because sometimes the hips, every patient I check their hips, it can be anterior on the right, but also twisted, right? So they can be in this, you have to look at all the different planes and have the patient, change position. And you see these compensations in the body, right? Because if this is high, that means something else is going to hike up, like your hip. Right shoulder up, left hip will right, in order to create an evenness. So sometimes treating the source of the pain isn't really the source of the problem.
is there, you mentioned needing to find a practitioner for this. Is it like, are chiropractors trained, or is it kind of catch and catch can, whoever has studied this unique aspect? Could be Rolfing, could be,
There's a
other
plethora
types
of things
right,
people can
right.
do. I mean, really, truly. I mean, chiro, some of them do a lot of soft tissue work. Some of them don't do any. I have always, in fact, I was going to go the chiropractic route, and I was a massage therapist at the time, and I just couldn't understand, like, why adjusting the facet, why adjusting the bone would change things when it's really soft tissue that pulls the bones out of place.
Right.
So I encourage all your listeners that if you're going to go a chiropractor, find one that also works with the soft tissue, because the problem, yes, was here. I could have kept getting adjusted, and probably created ligament laxity there. But really the problem was here.
Right. Well,
You know?
I will say the chiropractors that I've gone to have all said to me that they've called it muscle memory, right? Which was their version of something's tight here, so it's pulling the bone out there. So they may or may not have known the fascial aspect to it, but they acknowledged that there was soft tissue involved in the bones being out.
And there are many different therapies, like therapies that can be done, from manual myofascial release therapies to injection therapies like I do, where you're actually putting water into the tissue to help with smooth glide. There are, yoga therapies, things that people can do themselves with foam rolling. I mean, literally all these therapies that create impact and have what they call shear, where you pin the bone against another, like the foam roller, and then you move you move against the fascia. You can literally change the fascial tissue by creating these shear forces. And I mean, it's very powerful work. You can create release that's impactful.
So let's talk about some of this. So first up, in terms of be it foam rolling or going to a practitioner, because there's two aspects. There's the, how do we make our fascia healthy, and if I have a specific pain. If I have a specific pain, it sounds like I should go find a specifically educated practitioner that understands not just soft tissue work, but has been trained. Is there some specific credential or studies that that I should look for to ask if they've been trained in?
There isn't really the fascial practitioner. There's massage therapists who go and get myofascial release work, where you're literally, creating release through fascial stretching. There are, like, somebody like me, I've got a potpourri of things that I do, right? From the body work I did in my 20s to the acupuncture work I did and, still do for the last 30 years. I do these injections with sugar, water, and salt called perineural injection treatment that literally puts fluid in, but also changes the nervous system, these receptors on the nerve that downregulate and downregulate all the hyper upregulated nerves around it. And within 5 to 10 minutes, people have less pain and more range of motion. And it stays typically. And then there's people who are doing, like foam rolling and, teaching people how to use different devices like lacrosse balls. In fact, when I get on a plane, I always take 2 lacrosse balls stuck together in a sock, and I put them on my back, and then I roll. I stick it on my butt, and I stick it into my hip, and the people next to me, I have to tell them, I'm squirming. And I just want you to know, like, I don't have ants in my pants. I'm just trying to release my fascia because I can't sit here for 5 straight hours. And, just to get off my rock in Hawaii, you've got to get on a plane for 5 hours. So, people can have all kinds of tools to self-heal and to release some of these fascial adhesions, for minor structural things. And then for bigger, major ones, having homework to do at home to help them to recover is also really important.
So and the myofascial, this isn't just simply stretching, although yoga, I mean, I'll oversimplify yoga to some version of stretching. I mean, there's far more to it than that, but that's not breaking up adhesions. So more for the fascial to break it down, and is it really kind of breaking down the adhesions and making it supple so that things like the foam rolling or the balls, and I'm going to give a small commercial for someone named Jill Miller and Yoga Tune-Up, who if you haven't seen Jill Miller and Yoga Tune-Up balls, she's awesome. a ton of exercises that she has for with specific using the balls. We've interviewed
That's
her
great.
before. She's great. Yeah.
So yoga is amazing, and that, like, when I first got back into yoga about 5 years ago, it was incredible.
Mhm.
It changed my body. It literally woke me back up again, changed my body. I ended up becoming a yoga teacher through the training because it was just so amazing. But it won't be able to break up those fascial adhesions that may be really stuck on people, like in their TFL, which runs from the hip to the knee, right? The tensor fascia lata. In the lumbar fascia, it might not be able to get there. Fascial workers who know how to get in there and do that fascial cheering can make profound impacts. Prolozone, which I use too, which I'm injecting a procaine, and then I put in ozone. Ozone will break up these fascial adhesions. It brings in water. It upregulates the mitochondria, which make energy. It decreases inflammation. So by using these various therapies, depending on where you are in the spectrum, you can have profound impacts in your range of motion, in your fluidity of movement, in your freedom of movement.
So I have to say the injections make me, they seem very extreme. So, and I always get like, but this is supposed to be so gentle and break it up, and you're going to stick a needle in me and stick stuff in. So is that for the deeply tight and pained people, or is that, again, I'm sitting here going, I'm trying to create order in oddly this kind of this context of fascia that folds on itself. Like it's not a single-minded issue, right? Because there's maintaining the health, and there's breaking up knots, and there's getting the lubrication. So I'm sitting here in my mind as we're talking going, wait, I have to get that more orderly.
So here's how I think of needles. And I said it to a patient the other day, and it was like an epiphany for me. It was like, oh, I've been using my hands my whole life, right? Since my 20s. I was a massage therapist. I was one of the youngest massage therapists licensed in Washington. I can use a needle to get places my fingers can't go.
right.
And I can impact that tissue really profoundly by changing not just fascia, but also the collagen, the connective tissue, the ligament. I can go to the enthesis, like right where the ligament hits the bone and the tendon hit the bone, and I can impact that. I can impact underneath the scapula. And you can't get there with your fingers. And it's profound what can happen because of the nutrients that you put in, because of the different ingredients that you put in, like the ozone. It's profound. Now, do I use it on everybody? No.
Right.
If somebody comes in with osteoarthritis in their knees, their shoulders, their ankles, yes. Do I use it on a really big trigger point? Yes. Trigger point therapy is amazing. You put a needle into that fascial adhesion, that snarly mess of tissue, and you can see it release. Just it lets go. And it can be permanent. I mean, that's the amazing thing for people with chronic pain. It can be amazing. Or people that are chronically stuck, right? Like that netting is stuck over here. So instead of getting 10 Rolfing sessions to have it get unstuck, I can release it. But you also need to look at the hip, right? If it's up here in the shoulder, like what's going on there? And that's where you do the other kinds of therapies, get them stretching, get them doing myofascial release work, have them maybe do the Rolfing for the rest of the picture, because you have to look at the whole picture. But these therapies are truly amazing for people with chronic pain. They're amazing.
All the average achy breaky people that are sitting there at home that are like you and me, you and I were like complaining about our aches and pains. Although you less than me because you do all this stuff. I talk about doing this stuff. But where do they start? So like what should they be looking at? Is it so rolling? And is it, I mean, and is there, and I do roll, but rolling where, like are there YouTube videos? Like how do they start rolling, or do they just roll wherever it's tight and it's cross? Like is it, they roll with the muscles or against?
Okay, so let's talk about what's actually happening when you do that. So anytime, one thing I loved about studying fascia, because I've taken all these courses now, is that when you press down on the tissue, you push fluid out, But then when you release your hand, more fluid comes in than was there before. And when you have fluid between fascial planes, things slip and slide and they move better.
Right.
And fascia itself, the goo in the fascia, the goo made by fibroblasts, right? The goo is what determines how slippery you are and the quality of that goo, how much goo. So what I would start with everybody out there, whether you have myofascial pain, whether you have fibromyalgia, whether you have like systemic chronic overall pain, you need to drink water. Like that's number one, because, and if you drink half your body weight in ounces, you need water to hydrate. Literally think of a little plant that you saw in the morning and it's kind of dripping, drooping over, and you put water in it and all of a sudden within an hour it's standing upright. I mean, it's the same thing with your fascia, with your body. You need to have fluid and water. Then for people who, then we need good nutrition, right? We need really good nutrition for everybody. Everybody needs to be on an anti-inflammatory diet because inflammation is systemic. It isn't just in your intestine. Good nutrition includes good supplementation, I think, in this day and age.
Right.
So things that decrease inflammation, like curcumin from turmeric. There's a really amazing nutraceutical called PEA. And PEA, I'm going to say this the best way I can because it's not phenylethylamine. That actually helps with mood and dopamine, but it's called palmitoylenilamide.
We'll get that link on there for somebody.
It's unbelievably hard to say. But
Right.
anyway, this is made from fat and it's made from egg yolks. It's in peanuts. It's made from palmitic acid. It's now a supplement. And it's basically a signaling molecule that downregulates the inflammatory response. And it works on these other fascial cells called glial cells, and it works on mast cells. So people with a lot of allergies, it helps to downregulate. And it works in the central and the peripheral nervous system. So for my patients with fibromyalgia and patients with, chronic pain in their bodies, some of these seniors I work with, they have chronic pain. And so putting them on the right kinds of nutraceuticals can really make an impact.
So how about the other fats? So if you're saying that those are fats that are in eggs, like that's in eggs or in nuts, can they eat those foods?
They can, but I don't think they'll get the same concentrated amount that they would need to make a biochemical effect happen in the body. Right. So I would be more interested in them taking it as a supplement, actually. And this is kind of a new kid on the block too, as far as supplementation go. I do have patients take fish oils with it because the fish oils are the omega-3 fats, but this particular type of fat actually works with these cannabinoid receptors, not the same ones like CB1, CB2, but other cannabinoid receptors.
Right.
So instead of having to take CBD, you can take something like this and also have kind of an upstream effect on the inflammatory cascade. So shoring up sort of the constitution of the patient is really important. And then depending on what a patient has, so if they have systemic body pain,
let me stick on the foods per second, as long as we're
okay.
Then we'll go back to the physicals. So omegas, how about you mentioned collagen before. Collagen, so should people take collagen? My daughter throws collagen in her coffee all the time.
I think it's not a bad idea because at least you're getting like proline, some of the building blocks to making good collagen. I just have always wondered, is eating it going to then just get broken down? And I mean, maybe it's giving you at least some of the substrate that you would need. I like the idea. I just don't know if it actually works.
So there's no proof yet, but you can try it. It's harmless. How about things like glucosamine and chondroitin?
Okay, so what's really neat about those products, and they've been around, I mean, my whole career, like seriously, since the 90s, people have been taking them. And I do think there's some benefit to them and that they increase glucose aminoglycan synthesis, which means it helps to build cartilage, right? It helps to build cartilage. And these GAGs, glucosaminoglycans, they actually are part of also fascia. They're also part of our connective tissue. So I think there's some merit to it. Yes, and there's research to back that up too.
Okay, gotcha. And how about, you were talking about the inflammation that as you get inflamed throughout your body, you're also getting inflamed in your fascia, which then creates problems with it. How about then, I'll call it the classic anti-inflammatories in terms of antioxidants, vitamin C, NAC, things like that.
Well, I would say yes. And again, like if we're looking at boosting antioxidants, our most potent antioxidant is glutathione.
Mhm.
And that glutathione helps us detoxify heavy metals, helps get rid of mold toxins. It's a very powerful antioxidant for the nervous system. N-acetylcysteine will help to recycle your own glutathione.
Mhm.
Selenium will recycle your own glutathione. Lipoic acid, right? It's a fat soluble antioxidant and water soluble. So it's an amazing, actually lipoic acid's amazing for anybody with nerve pain, like neuropathies, small nerve fiber neuropathies, large fiber neuropathies. I mean, it's very important for people post chemo to get onto lots of lipoic acid to help the nerves to heal. And it has this incredible ability to recycle that glutathione. So the less inflamed we are, the healthier we are. The less inflamed we are, the better we feel.
Right.
So yes, anything we can do to move in that direction of less inflammation and away from more inflammation.
Okay, which helps the fascia as well. All right, so now let's go back to some of this, like the body work. So now I'm drinking my water, I'm all hydrated, I'm all gooey and all that sort of stuff. Um, let's go back to I'll call it the self massage, or like, what can I be doing to help make my fascia more supple? I don't know if that's a good word
Okay,
for
so
it.
I think having a really good routine that you do consistently would be it's important. In fact, it should be, you know how they say we need to do aerobic exercise,
Mhm.
weightlifting, we need a fascial routine. Now they say stretching, so I think stretching is really our fascial routine, and that can be done on our own, and then we can have certain tools at home to make that work for us.
But
So
what
having some,
this is, the fascia is far more than stretching though. So stretching is part of it. It lengthens the fascia, but it's not breaking up the tightness of it per se.
that's right, that's
Right.
right. You did your research.
Thank you. I,
So that's where the lacrosse ball comes in. And what I recommend people do is that they probably will, it depends on the degree of which they have fascial adhesions. So if the fascial adhesions are something they can release on their own at home, do it. And like you said, you have a great resource for a yoga person. There are lots of online videos about how to release fascia with foam rollers, with lacrosse balls. Um, there's a great book out there called Standing Up to a Sitting World. I have it somewhere around here. Um, and he's got wonderful tools of where you just take the ball, put it into your shoulders, lean against the wall, get into it, go against the corner, like here, this
love
corner of
that.
this wall here.
I do
Yeah,
that all
and
the
you can, yeah, literally dig in there to get your rhomboid and to release the subscap. There's a lot that you can do with pressure and some movement. And if that doesn't do it, then going to see a practitioner who knows how to use shearing, because shearing, you really need to have the pressure on the outside, the bone on the inside. So you've got two kinds of pressure, and then you need somebody to work to shear the fibers in the opposite direction that they run in order to get them to release. And they will. And not only will they release, but they will also create a much healthier fascia milieu, much more healthier fascial cells. It will literally increase new blood vessel formation. It'll stimulate the local immunity. So, there's just some really amazing therapies out there that can help people to live and live more freely, have less pain.
So to that point, what's the expectation? I was talking to an anesthesiologist friend a while back, and he said one of the mistakes they make in anesthesia, and this relates to the opioid crisis, is that there's this, they ask people to, I'll call it, rate their pain on 0 to 10, and the goal is always 0. But is 0 pain really a realistic thing? I mean, that we talk about breaking up adhesions, working on us ourselves, and I'm gonna, I was talking to you before. I actually, the last couple of days, spent a lot of time stretching, and it made a huge difference. But I still wake up stiff. Like, I'm always going to have some level of it. So, what's the expectation for people to have of how they will feel? Is there such a thing as I will not feel tight at all? If, once I'm past the age of 3, you know what I mean? Like, so I'm trying to like set an expectation for what people should do so that they know, like, what if I work on this myself today, if I roll every day, but I've been rolling, but it still hurts me tomorrow. But is that just part of the process, and that it just is something that you have to maintain, versus when do you go to an expert? And even then, once they break up those adhesions, you still may not be, you know, doing cartwheels all over. You know what I mean? Like,
Okay.
I just want to set an expectation for what's normal. No one knows what normal is, I guess.
Well, I would say that what's normal is to not always be in pain. And if you are, you should definitely go see somebody, because there are many reasons why you may be in pain, systemic, even systemic or local. For instance, I had a patient come see me maybe 10 years ago, and she had chronic pain all over her body. Was chronically cold. She had moved from somewhere in the Northeast down to Florida to try to get warm, and finally ended up in Texas, couldn't get warm in Florida, so went to Texas, couldn't get warm there, moved to Hawaii. Came to see me, and my back, gosh, 10, 20 years ago, when I didn't know what to do with a patient because it was too complex a case and I needed to run tests first, I would just say, why don't you just get off gluten? Just get off it. This is before it was a fad. Just stop eating it, and let's just, come back in 2 weeks. We'll have some labs back, and then we can kind of take it from there. And inevitably, people on that spectrum of autoimmune disease, almost everybody got some measurement of better. Like they got a little better. This patient in 2 weeks came back and was like, I cannot believe what just happened.
Right.
I am not in pain. All my pain is gone.
Wow.
Now, we then went on a whole discovery of other foods she was reactive to through blood testing and elimination challenge. And we worked on her gut wall, and, we did the whole naturopathic thing that we do. And this woman is no longer in pain. And she was in systemic 8 out of 9, 10 pain all the time.
All right.
So, and then what's the expectation? I think people should be able to live freely and have freedom of movement.
Right.
But we do need to work at it, especially as we get older. So we need tone and strength. We need to have functionality. So if we're constantly just doing a bicep curl, well, your muscle's just going to get shorter and shorter and shorter. So we also need to lengthen that muscle so it's functional. You can see this in bodybuilders that have shortened bodies, like they can't really move. And that's from the type of workouts that they've done. And I think people don't want to be limited in that range of motion. They want to have, freedom of movement.
Mm-hmm.
So I think expectation is, people shouldn't have a lot of pain. And if you do, then you need to modify your workouts, modify your stretching routine. I personally started getting really injured when I took my yoga practice to like the new level, right? I started going to the advanced classes. I was now doing like all the big things. We take your leg behind your head kind of stuff, right? Right. And I was like, well, why? I start getting injured, right? Because I'm actually more the temple dancer. I actually have a lot of ligament laxity. I'm more on that spectrum of loosey-goosiness, fascia. Yoga was easy for me. Gymnastics was easy for me. But at my age, taking myself to extremes actually put me into a category like where I was getting injured because I don't have the same sensory feedback that other people have to say stop stretching. And so it's kind of like putting yourself in an exercise routine and a stretching routine that's appropriate for your constitutional type, for your fascial type, for your body type. Some people running 3 to 10 miles a day is perfect for them. Somebody with a lot of ligament laxity, not a great thing for them. But ligament laxity people probably shouldn't do extreme yoga. Ligament laxity people or fascial laxity people need to do more weight training, Pilates, resistance training, right? You know what I'm saying? So it's also figuring out what fascial type you are and then creating a program that works best for you.
I was just going to ask you, how do you diagnose your fascial type?
Well, okay. So if you can take your thumb and practically touch your wrist, this is called Brighton score. It's one of the tests. See how close I can go?
Touching your wrist?
Yeah, practically. So if you can do that, straighten your arms completely and then do it.
Yeah, no.
So you're a little stiffer than me, okay? But you're actually pretty loose. So you probably need to do strength training. So people that naturally can do splits, naturally have a lot of laxity, a lot of fluidity in their bodies, they actually need to shorten things up a little bit. They need to have their muscles provide more tension so that they have better tensegrity,
Right.
right? The tension and integrity. People who have, that are very stiff, that really cannot bend forward and touch the floor with their, straight legs and bend forward and do Uttanasana. Those folks actually need to stretch more, right? And actually learning about fascia helped me also understand like why, as a springboard diver, I was great at the tricks, but I just didn't have a lot of spring because my tissue didn't have the same kind of rebound fascia. I didn't
Right.
have the type of fascia, elastic fascia, that allows me to have bounce. Like you think of Simone Biles, right? I mean, she's
Right.
an amazing gymnast, right? She's got both going. She's got bounce and she's got the flexibility, but she's a power gymnast, right? She probably has a lot of elastic tissue, a lot of bounce kind of fascia. So, your genetics do determine what sports you're really good at. And then the work you put in to support your body and to support your functionality also then determines how well you're able to do that sport.
So it seems like, as with so many things, that people need to pay attention to their bodies, try different things, and watch how your body reacts to some of this stuff. So,
Yes,
right,
I agree. And I think as little kids, we kind of figure it out. Like I ended up in gymnastics and springboard diving and
right,
balance beam
right.
and cheerleading, right? It was all, it's all very stretchy and bendy.
And it
And
takes
then,
personality.
yeah, right. And then as a yoga teacher, it also made me realize like I shouldn't go into the advanced yoga training
Right,
because it's actually not good for me.
right.
It's actually going to take me to the extreme that's going to create more injury, which is exactly what it started to do.
Yeah, well,
And
I was gonna say, it's funny actually, because I think I've talked about before, I've been working out since the pandemic. I have a friend who's a trainer who I'd work with out with every so often. And to help her, because she was now out of a job basically, because no one was coming into the gym, she and I started doing Zoom training. And she and I have constant conversations about finding the right weight for me to use. And if I go too heavy, like I might be strong enough in some ways to use a heavier weight and I can do it, but I watch what it does to my body and then I might accidentally injure. So it's really is watching yourself. It's the combination conversation of what feels good, what feels like you can feel when you're pulling it in there, and you can feel when there's a false tension, and you really have to pay attention and watch your body on it and be part of it.
and
Um,
especially over 50, it makes
hey,
a big difference. It really does. Your
right,
collagen is different. Your connective
right,
tissue is different. And if you take hormones, it's different than if you don't take hormones. So yeah, I agree completely. And the amazing thing about so many exercises today, like there are these little subtle movements that you can do, like in Pilates and some of these other kinds of trainings that make such a huge impact. Like you don't necessarily have to do like you said, the big heavy weight to get the impact.
nor is it my goal. At my advanced age, all I want to do is be fit and look pretty good. I'm not looking to do a marathon. I'm not looking to, be Simone Biles. I just want to look pretty good for myself and feel
Right,
that's all.
right, right, right,
I
right,
don't need
right.
to like deadlift whatever I need to do, whatever she wants me to do. There's a question from someone, Christina, was back to the food conversation. She talked about how tomatoes add do tomatoes add inflammation? That's her specific question. And is there something
Okay,
about
so
tomatoes, or is it individual, different people, different sensitivities?
Okay, so some people have problems with the nightshade family. A lot of people do, actually. The nightshade family are tomatoes, potatoes, eggplant, pepper, okay? And the nightshade family, some patients with chronic pain, fibromyalgia pain, just pain, arthritic pain, do very well when I put them on a nightshade-free diet. Now, if they're also on a low histamine diet and they're on a FODMAP diet and they're on a food allergy diet, I mean, it starts to get a little crazy.
Right,
So we have to kind of
right,
piecemeal like what's
right.
appropriate here. But I do think exploring, avoiding those things can make a difference. I've definitely had at least 10 patients where it was a profound difference staying off of nightshades.
Watching the diet. Okay, good.
Yeah, and I think it's very individual, actually.
Right. Well, because we all, like you said, the woman that had the glucose, or not glucose, the
The
gluten
gluten. Oh
intolerance.
yeah, I mean that was profound. I mean, I'll never forget her case. It was profound. It's it's changed her life even to this day. I still know her.
I have another question from Rebecca is asking, so exercises, are there any other exercises or suggestions for people who aren't as flexible with the thumb to wrist? So what kind of strength training? Is it literally just strength training kind of stuff, or are there,
Well, people who aren't as flexible actually need to
Okay.
do stretching, right? So it's the loosey-goosey people like me that need
Right.
more muscle and
All right.
strength training.
Yep.
People like her need more stretching. And, doing Iyengar yoga, it's very safe. The reason why I chose that method, it's very structured, it's very safe. It's slow, and a lot of it's kind of like a meditation in motion where you're bringing your consciousness into the left lateral heel while at the same time in your medial front toe, right? It's like it's a very quiet but very intense, and allows for very safe stretching. So I think for very stiff people, Iyengar yoga is a very good method to follow. Some of the other methods may not be as good for them because it's flowing, right? It's moving from one thing to the next. It's very fast. So those types of yoga may not be the best. A warm room yoga, like there's that Bikram yoga. I don't know if that's still happening or not. But doing yoga in a warmer room can be very effective too for those stiffer people. But Bikram also moves from one thing to the next without a whole lot of detailed instruction. So I think the detailed instruction, like with Hatha yoga, Iyengar in particular, it's kind of known for that, and using lots of props like chairs and blocks and yeah.
Gotcha. How about something like swimming?
Swimming is very fluid motion. Swimming is, I think, great for everybody because it's going to build strength and it's cardio and the whole thing with the water. There's something about water.
But I'm thinking that it's more fluid versus playing basketball where it's just tight and jumping and all that.
Yeah.
All right, one last question and then I will let you go. And thank you, weather gods, because you've been kind to the technology gods. If somebody wanted to go to a practitioner, so who are the options that they should research, and what should they ask them? Do they know?
Okay, so I can say that if you needed whole body structural integration work, I would go to a Rolfer, somebody who does structural integration body work. They are trained to do body reading, ask questions about their training. If they've been trained by the Ida Rolf group or something similar, the structural integration folks, those people are amazing. If you just want field,
I would know that I need structural integration because I just have overall aches, because I have disparate pain in different parts of my body. Why do I know that I need structural integration?
I would say that you need it because you have pain, because you've been to massage therapists, you've tried acupuncture, it just isn't working, and you want to get to the source of the problem. And I would consider a structural integration worker, because you'll have to do it. They'll do a series of 10 treatments and they'll work on changing your posture and where the bones are in space. They're going to shift those, where we talked about the fascia being pulled, right?
Right.
They're going to help not only release that, but everything downstream as well.
Gotcha.
So I think that those folks are going to really help you with that sort of whole body structural change that you want.
Gotcha. Okay. And then
if you just have tight shoulders and a neck and it's just temporary, go to a massage therapist. They're wonderful. They'll push on it. They'll bring more fluid in there. They'll lengthen, it's wonderful.
And does regular massage, massage is something that you can do every so often, or I think of that actually as a maintenance that it's healthy to do on an regular basis, as I'll call it, just to keep yourself more supple.
That's right. That's right.
Get your partner to do it.
Yeah.
It's trade with a friend. All right.
Yeah. And
go ahead.
And get massage on your feet. I mean, your feet are so intimately connected to the rest of your body. Just releasing your feet, people with, releasing your feet is really important. So, women that wear those high heels, oh my gosh, their feet they have problems, and then they end up with problems in their hips and their back and their neck. If there's one thing you do, is just take that lacrosse ball and rub out the bottom of your feet. it'll change your whole body actually,
Yeah.
because of the way the fascial planes are. And go to a book and look at like those different fascial lines, and you'll see the interconnectedness, the spiral line, the deep frontal line, the deep the back line, the side line. It's amazing actually when you start to see how the fascia wraps around the body. It's pretty. It's amazing.
Crazy. It's like, again, I saw this illustration of, it was like Spider-Man, Spidey that just had this whole Spidey thing around us that just, pulls in different directions. You and I could talk for hours, but we're going to stop now and let everybody go back to their lives. And I'll let you go back to your day. And I can't appreciate you, can't thank you enough. Your website, again, for anybody that wants to get in contact, drsteelsmith.com in Honolulu, but you do phone work as well, correct? And what else was I gonna say? Don't forget, download those free books that are listed there. Subscribe to us on YouTube, and everybody go out there, stay safe, stay healthy. Thank you, Laurie. Thank you so much.
Thank you.